Hi, how you going? I hope you're feeling as well as possible on your medicines. I'm Pharmacist Fi. Welcome to my YouTube channel. Today, I'd like to chat with you about two very similar sounding words that a lot of people accidentally mix up when they come into the pharmacy, but they mean quite different things. So this video is to help you know the difference between genetics and generics. Genetics is a word for talking about your genes, which are made up of DNA, which is what controls a lot of things about how you look and how your body works. Whereas generics are a type of medicine brand, and one way you can remember the word generics is that it has an R in it for right, because it's the right word to use if you're talking to a pharmacist or pharmacy staff member about which brands of medicines you may or may not want. So, what are generic brand medicines? And how are they different from original brand medicines? And does the brand of medicine you take matter for some medicines? An original brand medicine is made by the first company that ever made the medicine, whereas a generic brand medicine is a copy of that medicine by a different company, which has the same active ingredient as the original brand medicine, or the same active ingredients if there are more than one. And remember, active ingredients are the things that do what the medicine is supposed to do, and we'll talk about them in another video. But generic medicines are usually cheaper and may contain different non-active ingredients from the original brand medicine. So some generics may look, feel or smell different to the original brand medicine. And while most people don't feel any different, some people may feel slightly different on one brand compared to another brand. But overall, generics have the same main effect in our body as the original brand medicine because they contain the same active ingredient. Now you know what generic medicines are. Here are 3 medicine safety top take-home tips. Number 1, ask your doctor or specialist if you need to try to only take one brand for any of your medicines, because there are some types of medicines where it may be safer to only use the one brand of medicine. For example, medicines for epilepsy. And there are some other medicines that this may apply to as well, so always ask your doctor or specialist about this. Number 2, ask your doctor or specialists if they have any preferred brands for any medicines you take. And you may find their preferred brand might be an original brand, or it might be a generic brand, or they may not have a preference, but it's worth asking, especially for any medicines where they advise you to only take one brand of that medicine. Number 3, if you would ever like to tell your pharmacist or a pharmacy staff member that you either prefer generic medicines or that you don't want generic medicines, either way, make sure you use the word generic, not genetic. By remembering generic has an R for the right word to say to the pharmacist or pharmacy staff member, so then you won't put a confused look on their face. Please click the subscribe and like buttons below this video if you'd like to see more of these medicine safety videos. And I look forward to seeing you again very soon here on this Pharmacist Fi Medicine Safety YouTube channel. Thanks for watching. Bye.